Okay, thank you very much for all the participants already connected. Welcome to this session. My name is Alexander Gruber. I'm the Regional Advisor for Health Technology Management at the Pan American Health Organization. Thank you very much for your participation. Today, as you can see in the screen, we have the fourth webinar of this series with the topic acquisition, including donation guidelines and deployment of technology. Again, we have the Professor Tobey Clark with us. It's a pleasure always to have this collaboration with Professor Tobey Clark in the University of Vermont, the WHO Collaborating Center for Health Technology Management. I'd like to remind you all that we had already, of course, in the fourth webinar, so we had 3 webinars already, and with great participation. The first one, integrated approach to health technologies, regulation, assessment, and management. The second one on showing the value of healthcare technology management, with the first one in July, the second one in September. And we have another one in September, capacity building for medical equipment, maintenance support, and management, with great participation. So we're very glad to give to continue in this series. Thank you very much. And I would like to thank, of course, Professor Clark for this great collaboration. Also my team at the unit of health technologies at the Pan American Health Organization, specifically Francisco Cacavo, Afonso Rosales, and many other colleagues that are helping with these sessions, and Abraham and other colleagues. And of course, we have the best moderator ever, Begonia Sagastui, my colleague that you already know a lot, not only for previous sessions, but all the brilliant work she has been doing with the Caribbean region. So Begonia, you have the floor. Thank you very much again for moderating our sessions. I think it's, besides the interest in the topic, I think lots of participations because of your fantastic moderation, and I think I would not be able to do like you. So thank you very much. The floor is yours, and then you close my mic and camera to the end of the session.
Thank you so much, Alexander. It's always a pleasure for me to be here in these sessions and to join you for this very exciting fourth webinar of our series that, as you already know, it is on a topic that is extremely important for the countries in the region, also for our PAHO offices that I already see in the list of participants, that we also have a lot of people from the PAHO offices today. And that is precisely acquisition of health technologies, and also including the component of donations, that they can sometimes be really helpful, but also a headache in some circumstances. So we're going to be here today sharing experiences about the challenges that we have when we're acquiring medical devices and other health technologies, and also when we receive donations. So we're very, very excited to have this topic today that is so relevant for the region. We're going to be following more or less the same structure of previous webinars. For those of you that have not been here with us before, we first start with a short interaction using Slido. So we recommend that you have your phones around, or that you open another web browser so that you can be interacting with us. And then we'll have our keynote speaker. And afterwards, we have a session for questions and answers. But this time, we're not only looking for questions and answers, we're looking to know about your specific experiences regarding the challenges on acquisition and donation. So please do not be shy, share the experiences. You have the chat, you have a section for questions and answers, and we can, well, I'm sure we can even look about the possibility of opening a couple of mics if necessary. So without further ado, we're going to start with our interaction. For this, I would like to invite to the floor my dear colleague, Francisco. Francisco, the floor is yours. Please introduce us how to work in this exercise on Slido today.
Thank you very much, Begonia. Hi, everybody. Well, for those who haven't been with us before, we're going to do this exercise that Begonia has now explained. It's going to be a live poll using Slido. We have 2 ways of doing it. You can either use your cell phone, which is probably the easiest way. With your camera, you scan this QR code right there. The other option is you go to slido.com and you introduce the code, and you'll have a window like this one here, and you use hashtag HTM Caribbean 4 for this is our fourth HTM webinar. So you have either option, whatever is easier. Probably the cell phone is the easiest, but you can pick either. And once you are there, once in the event, you will prompt it on the polls tab. There are two polls, Q&A and polls. We won't be using the Q&A tab. We're just using the Zoom Q&A. On the polls tab, you will be prompted some questions. The first one's going to be, what country are you from, or are you now? In which country are you now? And you can start answering right away. So now, just a second, let me switch to the other window. Just a moment. And one second. Okay. I hope, okay, now I hope everybody's, please let me know in case there is some problem or you're not seeing or anything. So as I was saying before, you can scan it now. If you don't have a chance to scan it, don't worry, it will be here on the side. So let's start with the survey. As we were saying, it's going to be audience characterization. So the first one is, in which country are you located? So your responses are going to start showing up here on the screen. You can write it down, and we will start seeing your responses as soon as they appear. Please don't be shy, and all participants. Until now, we haven't had, it is strange because it says 0 participants. I don't know if there's any problem or anything. Okay, there we are. It maybe takes some lag, it takes some time. We have 2, 3, Barbados, 6. So the first question usually takes a bit longer. So I ask everybody for a bit patience, but it's very good because it really shows us it gives us a good idea of where are the participants from and how many participants from each place, and everybody can see it. Okay, 14, 16.
Francisco, we have also answers in the chat, if you can see.
Okay, just a second, because I wasn't seeing the chat. Thank you, Alexandre. Okay, yeah, it's also good to mention, if you, for some reason, you cannot access the slido.com app, you just put it in the chat. So in the chat, we have Haiti, St. Vincent, Anguilla, Bahamas. Well, it's good because those weren't represented here on the Slido. So most of participants are from Trinidad and Tobago. No, well, I don't know. Belize and Trinidad and Tobago are there back to back. Then we have Barbados, Bahamas, Suriname, Antigua and Barbuda, St. Lucia, Bermuda. Bermuda and Barbados are both pretty big. We know that usually not all participants can join, and so we usually wait. At this moment, we have 47 participants. So maybe we can wait a bit longer until we get a couple more. Okay, 20, until we move to the next question. And we are still getting many from on the chat. Bahamas, Jamaica, Conchita Lebert, Trinidad and Tobago, Bahamas. Okay, so this is more or less, even if we get some more, we probably won't change as much, but this is the population, the representation, country representation we are having today. It's good to have you, very good to have you all. So now we're moving to the next question. Okay, a few more. Grenada, Suriname. Okay, great. In what type of institution do you currently work? PAHO, 33%. So we have many of our country representatives there. It's great to know that. Hospitals, 28%. Ministry of Health, 28%. Other, 11%. So no academic institution or non-governmental organizations. For other, we have 11% putting others. Feel free to put it on the chat. On the chat, I'm seeing also other people writing that Lisa Gold Brown on Ministry of Health, and Vesta Smith on Anguilla Hospital. Okay, and okay, more people on Ministry of Health. So mostly are from Ministry of Health, many from PAHO as well. It's good to know so many from hospitals. Great, so we're moving to the next question. What is your educational background? So the other option is the 26%. So as mentioned before, please feel free to put it on the chat. It would be interesting and informative to know who's coming, what's their educational background of the audience. Management administrative 21%, biomedical engineering 16%, pharmacist biochemist 11%, biomedical equipment technician or other electromechanical technical field 11%, engineering 5%, and paramedic nurse we don't physician paramedic nurse 5%, and research academic 5% as well. Okay, it's changing. We have more of other 21 responses so far. Other is increasing. Okay, in the chat we have education registered nurse, midwife, public health candidate in training, Vesta Smith. Thanks, Vesta, for your response. And we're moving to one more question. No, a couple more questions. Background knowledge in terms of healthcare technology management. What's your background knowledge in terms of healthcare technology management? So almost 60% is intermediate. Then basic is 26% and advanced 17%. Okay, so it's good to know that a very huge percentage of the audience has quite good knowledge in terms of healthcare technology management. Intermediate knowledge, more than 50% of participants. Some have basic knowledge, and there's also quite a significant group, 17%, that have advanced knowledge, and there's no one that has no background knowledge. That's great to know. We've got an audience that's pretty well capacitated, known about healthcare technology management. And I believe this is the last question about participation in previous webinars. Okay, so it's 78% took part of webinar 2. That's great, showing the value of healthcare technology management. More, almost 80%. On webinar 1, 75% integrated approach to healthcare technology management, regulation health technology, regulation HTA and HTM. And webinar 3, 68%. And no participation in previous webinars. Okay, so we have 12% of people that are new audience to the webinar. Okay, so happy to have you here, and really welcome all that new audience. So also good to know that webinar 2 was even more popular than webinar 1 among the audience we have today. Okay, so this was our, it changed a bit, but yeah, it remained on the pretty much similar. That was the last question. It's always great to know our audience, and that all of you also know who else is joining you on this webinars. So that was the last question. I'm gonna stop sharing now, and again with you, Begoña.
Thank you very much, Francisco, for this. It's always indeed very useful to get to know the audience, and I'm really excited to see that we have this new crew with us today. It would be great, Francisco, if we can share again in the chat the links where they can find the recordings of the previous webinars, so you can watch them, you can share them with whoever you think that might also get benefited from them. And then let me introduce you to the person that has been fundamental for us to be able to do these webinars, that he is our keynote speaker, and this is Professor Tobey Clark. Professor Clark is director of the PAHO WHO Collaborating Center for Health Technology Management at the Technical Services Partnership of the University of Vermont, where he also serves as engineering supervisor. He has also been on the faculty of Electrical and Biomedical Engineering and Biomedical and Health Sciences departments, where he has taught medical instrumentation, clinical engineering courses, and indeed, while he has been working in the area of biomedical engineer area for over 49 years, he's a very dear friend of PAHO and of the Caribbean region, always willing to support us and help us to increase our knowledge regarding the management of medical devices. So Professor Clark, thank you again so much for being with us in this fourth webinar. So over to you so we can get started with this very interesting and relevant topic.
Thank you very much, Begonia. Really appreciate the words, and it's great to be here to be able to give this presentation. Also want to thank, of course, Alexandre and Francisco, who's been coordinating this activity. So today, again, it's also wonderful to see such a strong renewal amongst the individuals here who are attending these webinars. So today in the fourth webinar, I'll get the topic up here as Francisco had described. We're going to cover several different areas related to the introduction of technology into the healthcare system. And this would be acquisition, including donation guidelines and deployment of technology. Okay, so acquisition is the first topic that we're going to cover. And if we look at the life cycle diagram, which you probably have seen before in previous presentations, acquisition is really the doorway into use of the technology in the healthcare system. So acquisition is part of the planning process that has to do with healthcare technology, along with many other areas for planning, such as assessment. So acquisition, again, prior to deployment. One thing very important, and this is important to note, the total cost of ownership. It's very important, and this is for, of course, the biomedical engineering community who has an advanced level of healthcare technology management knows that the initial pricing of a technology is can only be a small part of the total cost of ownership of that technology. That purchase price and installation, shipping could be around 20% for many technologies. Whereas when we talk about the life cycle costs over the time that it's in the healthcare system, we have to include the costs of staffing, training, maintenance, consumables, utilities, upgrades. Software licenses is a new area that can be very expensive when you start looking at renewal process and upgrades. As far as training goes, that includes both training for the user staff that will actually operate the equipment along with the maintenance staff. Compliance with standards and regulations, quality assurance, and of course, deinstallation and disposal, which for some technologies is much more expensive than others. Something like a cobalt source is very, very expensive to dispose of. I wanted to touch on this point related to acquisition up front, and that's the value of standardization. Standardization is important to reduce the operator error. So standardized device operation results in fewer user errors. People are familiar if you have a single manufacturer for common equipment. So this would be things like infusion pumps for physiological monitoring systems, any of the equipment that might be utilized across the spectrum of the healthcare facility. And many times staff, such as nursing, have to work in different areas. So if they go from the emergency department to the operating room to the ICU, if that equipment is standardized, the operation will be very similar. Another point is better discounts for volume purchasing. So that would include the equipment itself, consumables, accessories, reagents for laboratory equipment. Lastly, more efficient maintenance. in terms of parts. To have a stock of parts for standardized equipment is a lot easier to maintain than many different brands. Ordering is simplified because you have one vendor to deal with. Service training, of course, once the training occurs, that knowledge base grows for the biomedical staff. So now let's go to the components of acquisition for medical equipment. The first and most critical part of the process is to determine what is needed. And you really need to look at that in an evidence-based manner. And in terms of what do you actually need in terms of the technology, whether you're looking for, say, an X-ray equipment, or you're looking for a surgical device, what will be the need for that? What is the population of patients that would utilize that? Blood pressure, for instance, how many channels have you used in the past? What's the projection for the future? That needs analysis is very important to be done right up front. And before the vendor comes in and say, this is what you need. So there's product research that would be done once you determine that need for qualified vendors. Many times there's a formal request for proposal, which I know many health systems, national health systems, have a standardized process there. For simple items, it may be just a product specification. In terms of the evaluation process, you're first of all looking at the response to the request for proposal and determining finalists, and then perhaps, depending upon the technology, going through demonstrations or technical evaluations, or in some cases, clinical trials for that equipment. So the next step, basically comparative analysis. Hopefully you may have more than one kind of finalist that would be appropriate, meet your needs, and you would negotiate to get the best price. In some cases, of course, you have a process that doesn't allow that negotiation. In terms of the decision process, using a decision matrix is helpful. And probably the most important part is the purchase agreement, because the time of maximum leverage is before you actually buy. The process, again, there'll be two types of acquisition. One is replacing existing technology. The other process is the purchase of new technology. So looking at those histories, what you have, spent, what your reliability, what your downtime, incidents, et cetera, for your previous technology that you're replacing, for instance, is important. Should be a multidisciplinary team. Of course, clinical biomedical engineering needs to be involved in that team, along with others, depending upon the particular item purchased. So both a clinical and technical evaluation is needed. And as part of the survey, which I described previously in terms of needs, there should be kind of a tool that allows you to get that input to determine that need. And of course, the budget is the bottom line. Some of the research that might have to be done is to look at human factors for the device. Can it be easily used? What is the user interface? What is the design of the equipment? Has there been human factor studies for that equipment? The specifications that come up that are derived, hopefully you have multiple vendors that can meet those specifications. So profile the manufacturers also according to your interaction, your experience, customer service, local support. Consult with others that are in your region or country. Project timeline is important to look at the milestones and goals, particularly when you have, say, facilities renovations that are part of that. Has the equipment been approved by international health systems such as the FDA, the European Union with their CE mark, or the Canadian Medical Device Directorate? Another area that you could look at is adverse events. And this would be associated with, like, the FDA has what's called a MOD database, which is basically you can search by the manufacturer, by the brand name, by other factors, and see if a device was involved in multiple or serious incidents related to adverse events. So in terms of the request proposal, so this is more or less the formal document, and it varies depending upon if you're a national health system. It's a very formal document. If you have more of an independent health system, it may vary depending upon the acquisition. But certainly the clinical requirements are important, but you need to leave room for innovation. So to be too specific in those specifications, you can unnecessarily leave out some different vendors. So this would be something like for X-ray equipment, if you required a certain KV that was a little bit out non-standard, and you may find that there are not many vendors that can reach that in terms of the radiology equipment. That may not be a great example, but anyways. Support requirements are a very important part of the request proposal. Service training, parts, documentation. For service contracts, their response time or uptime, we'll talk about that a little bit later. Clinical training, disposables, installation. Again, the reference list, talking to others that have the similar equipment. Environmental requirements, electrical, plumbing, temperature, humidity is very important for many of you, and general requirements in terms of delivery, warranty, etc. This is just an example, showing some of the factors related to a request for proposal. You may not be able to see that very well, but it's battery-powered defibrillators. You have kind of an instruction to the bidders, various points, what's being expected, if there's standards or regulations to follow. The equipment section, equipment requirements, and this is sometimes common or usually common. They're not that many pages. They are, very specific requirements to allow the vendors to be able to bid on the process. And the terms and conditions, of course, is much more detailed. It's basically what you need. So example terms and conditions, again, delivery, install date, and if that isn't complied with, there should be a penalty clause. Warranty based on history and needs. So if you have a technology that you found failed in the second year routinely, the next product that you buy to replace that, you may want to have a 2-year warranty rather than 1 year. Quotes should be valid for a period of time, meeting the codes and standards, regulations. All items on the quotation should be itemized. So you can go through and you can see which items you want. If you don't have enough in your budget, you can cross out the ones that are less critical. Clinical training meets credentialing needs. And if there's a process to, say, withhold money until the hospital accepts, that is done in the US many times, that technology. So that's a clinical acceptance of the technology. We'll give you the final 10% at that point in time. Service requirements also should be part of this. Service training equal to the manufacturer's training that they receive. If you receive that and the device goes under contract, there should be a discount for biomedical screening. Documentation, that's important now. Much of the documentation is digital. Updates, things like manufacturer's correction notices should be part of that. Diagnostic software, guarantee for availability of parts, and service assistance and remote support. All these things are part of what you should be seeking. In terms of contracts, if you're looking at contracts for typical devices like imaging or laboratory equipment, get the 1, 3, and 5 years, and also see if training occurs, you can get a biomedical screening discount. Other things, hourly rates for after hours, weekends, holidays, cost for training, parts, uptime guarantees. They're different for all manufacturers, and it's best if the hospital system defines the uptime. So like imaging equipment, it may be 90, 97%, 99%. What does that mean? Time of coverage depends upon the use of the equipment. So evaluating the request for proposal, once you finalize the request for proposal, send that out. with a due date meeting your needs. And first thing to note is, did you get the information back that you requested? The second is to basically put the RFP points into, say, a spreadsheet or something to basically look at the responses from the different vendors. There may be some areas that are weighted higher than others, so you need to specify that. Look at, obviously, the financial evaluation is important. You may not be doing that directly, depending upon how the financing would go, but definitely try to do it in terms of total cost of ownership and determine the finalists, and hopefully you have more than one. This is another sheet you may not be able to see, but this is something typically the biomedical engineers will do. They'll look at specifications and one device against another. This is for C-arms, a lot of radiology equipment here. In red, it shows the difference between the vendors, and the high points for some of the vendors are shown in red, where they have better specs. And the differences are pointed out fairly clearly to the clinical staff that may be reviewing this, or to the administrative staff. So this is kind of a biomedical engineering product comparison. Lastly, in terms of the acquisition process, purchase agreements. This is the final step where this actually, you may call this something different, but it's basically the final step where you're ready to buy, and you have to put in the final document, the critical document that meet your requirements now and in the future. Terms and conditions, service, resources, and life cycle cost protection, along with payment terms. But this is when you have the maximum leverage. Once you sign this and you order the technology, it's going to be more difficult. The next topic, which is related to acquisition, is donations. So donations, a lot of this that I'm going to present is derived from the WHO donation guidelines. I was working with a group with WHO that was coming up with that. It wasn't completely finished, the document, but I want to share what the latest revision, which is not released at this point, contained. So first of all, donations are partnerships. They're not just like single relationships, because you need single events, because you need to sustain quality. Importantly, recipients and potential donors must collaborate to establish the acceptability of medical equipment for introduction into the recipient's healthcare system. That's really important, that is a two-way street. It's not just dumped. It's something that you can use, that you can support, that you can maintain, you can operate. You have the facilities to meet with this. So the WHO, I'm not going to go through this whole thing, but they have a donation acceptability checklist that is, first point on this is device clinically relevant, and will it strengthen the healthcare system? So here's a list of various points related to that question. Facility assessment report, for instance, report of infrastructure, resource availability, and clinical demand. That's important. You need this, basically. The device represents the most appropriate solution. Device meets specifications, etc. So this is the first point. Is it clinically relevant? Will it support and strengthen the healthcare system? The next question is it sustainable? So is there a sustainability plan for this? And this assigns responsibilities to individuals related to this new technology within the healthcare system and within the vendor system for that technology. Things like spare parts, consumables, end-of-life disposal even. So this is the next step. The next two questions, one is the device meets safety and technical regulations. Safety is very important, patient safety, but also staff safety. The fourth question, will the device be functional if it's installed as instructed? So that basically means, is this going to meet an acceptance test that you would administer? Is the device compatible with the existing infrastructure? So something as simple as, is it at the right voltage? Is it at the right frequency of power? So power line has different frequencies in different countries. Is there a budget that covers the device operating costs? So it can't just be you get the equipment, maybe it comes for free, but what is the operating cost? That involves people, that involves consumables, that involves spare parts. A point person, they're recommending that that should be assigned a senior technical leader, should basically provide consistent oversight related to this. Lastly, does the donation meet national procurement, exportation, and importation regulations? Now that's kind of a standard statement. Does it meet your regulations of the equipment coming in the country? So if all those answers are yes, then the donation proposal is acceptable. The last topic I'm going to cover is deployment. So deployment, again, is the bridge between the planning process and the management process once the technology gets into the healthcare system. The basics are, you have a project related to deployment, that delivery. There's some basic steps that get followed. Very importantly, there needs to be roles and responsibilities assigned. It's always a team that works together. And the key success factors are basically for that to occur. So for a general project, and this particular example is more kind of related to a medical equipment that requires construction. You have planning and programming, then you come up with a design. You develop that design based on review process. Then you develop construction documents. So if you're going to move a room, or you're going to lead line it, or you're going to put in new utilities, those documents are created. Then the construction occurs. And of course, the occupancy of the device, patients, staff is the next step. So the process for installation, basically planning with that vendor that is doing the installation, or you're doing it yourself. It's still a planning process. The timelines, deliverables, site preparation, shipment and customs, storage, transport, delivery, and installation. The last step is basically for equipment. You may not always have to install equipment and change the building, but regardless, you still need to do acceptance testing and inspection. The first step, though, is make sure everything came in good order. Manuals, consumables, accessories, the equipment itself, ensuring that everything that was ordered came in unharmed. Checking for safety and performance. And once everything checks out, then it can be put into the asset documentation system, the computerized medical equipment management system. Not really going to spend too much time on this, but training of users and maintenance staff is critical. So when everything's A-OK, commission it. So in summary, in terms of acquisition, or many people call that procurement, total cost of ownership, primary cost consideration, evidence-based needs assessment is critical. Standardization. Hopefully your system allows you to standardize on common equipment. Maximum leverage is pre-purchase. This is in red because it's so important. You try to get things after you bought it, it's very difficult. Donations, again, require recipients and potential donors to collaboratively establish that acceptability of medical equipment for introduction into the recipient's healthcare system. It has to be a two-way street. Lastly, deployment has to be planned with a project management approach, which I described. Many times, implementation really determines the success of the whole technology utilization in the healthcare system. All equipment should be inspected, medical equipment, prior to patient use. And commissioning is basically the total process that looks at all aspects of that equipment introduction. So thank you. And we'll move on to questions.
Thank you very much, Tobey. As always, it is very useful and enlightening to hear you. Once again, everyone, we invite you to post your questions and answers in the chat. We also have a specific section for questions and answers at the bottom of your screen. You can use any of them. And I would like to give the word to Alexander, that he has his hand up.
Thank you. Thank you very much, Begonia. Thank you very much, Professor Clark. Excellent presentation. I usually prefer that open for question directly, but I think it will be important to complement this excellent presentation. It was we just hear from Professor Clark. The topic that was presented today, it's directly related to a very important initiative that PAHO has been implementing since the start of the emergency, the pandemic. So since beginning of last year, and we continue to do a process of quality assurance for medical devices. That's and I can see here in this meeting several colleagues from country offices and also from the regional office here, and I think it's of course they already know this, but I think it's important to share with the participants from countries that we have been with our team doing a tremendous effort to improve the quality of the medical devices that are procured by PAHO, either by the regional office or the country offices. So it's part of this, and this was included in the presentation by Professor Clark. There's a very important aspect related to regulatory aspects, regulatory compliance that was mentioned in the presentation, specifications, standards, and some of those evaluations that were performed by our team was for regional procurement. So as an example, we evaluate several mechanical ventilators, for example, and we cleared, we gave our clearance for a couple of them that was then procured by the procurement department and then sent to the countries that request those equipment. So that's just one example that we can use also personal protective equipment, and so several other medical devices that oxygen concentrators, oximeters that we did the quality assurance process at the regional level. Also, at the country level, we know that several countries have been procuring this through requesting support from our country offices to the procurement of medical devices. And then we also have supporting them to improve this process, asking for the necessary documentation, the certificates for those ISO standards, for example, regulatory information, the correct specifications. So this is a very important. I just wanted to complement, because Professor Clark gave an excellent presentation, but I would like to do this bridge with the work that we had been doing, and that's quite new. So we started last year, and we are just we working now and on a new policy, so we make sure that this is already not only during the emergency times, but all during regular times, we can keep working and keep improving the quality of medical devices that are being procured by PAHO and distributed to all member states in the region. So thank you very much for this opportunity, Begonia. I'm sorry that I interrupt you. Go ahead with the questions. Thank you.
No worry. And actually, Alexander, we're getting a couple of questions regarding quality assurance. So I'll get started first with a couple of questions for Professor Clark, but please do remain here with us, because we have one question regarding quality assurance. So Professor Clark, as you were mentioning, one of the key moments when one is procuring is the pre-purchase, right? It's our negotiating or where we have a more higher negotiating power. is it possible to include, or is it common to include training not only for users that will be occupying this new equipment that is being acquired, but also for maintenance? Because sometimes we do see that we receive some training for the users, but not always on maintenance. So can you tell us a little bit more about that, on your experience, what is usually being seen regarding training?
Thank you. It's important, particularly if you're using a formal process, the request for proposal type process, to include both training for the users and also for the maintenance staff as part of that process. So you will find out from the vendors what the opportunities are for training for maintenance staff, for instance, what the opportunities are to get the correct tools, the diagnostic software, whatever is required to maintain that equipment, but also get their service contract information, then use those cost factors and your particular context to come up with, should it be maintained by the hospital staff, or should it be maintained by the vendor? But it is common to have input to the request for proposal for service training for staff.
Thank you, Professor Clark. We also have a question from Paul Taylor regarding donations. That definitely they have been a challenge all over the region. He's mentioning that generally these donations are directed through politicians or administrators who are happy to receive donation in this free equipment. But as you were mentioning, it's sometimes more costly to really be able to operationalize it than to really purchase a new unit. So how can biomedical engineers, and I would even add here the technical staff, not only biomedical engineers, but everyone related to this area of management of equipment, safeguard the organization from this risk? And linking to this question, this would be also for Alexander. Alexander, in donations regarding quality assurance, are there any recommendations or comments that we should give regarding what quality assurance processes we should have with donations? So over first to Professor Clark.
Well, I provided the WHO guidelines. Those guidelines are rather strict, I guess, and the political aspect, when that comes into play, that certainly complicates the ability to go through that kind of checklist of sorts. I think, it kind of goes back to the first second webinar we had, which was on, showing the value of HTM, so that you say politicians, but it could be, say, a clinical leader that has a relationship with a company or somebody that's donating. If the biomedical engineer is well respected, there'll be a communication between those two about that process. I think that the biomedical engineers can show their value by commenting regarding any of the donations that take place, and I think it's important that they do so.
Alexander, regarding the quality assurance process, what can you complement?
Yeah, our recommendation is that we follow the same process, regardless if it's donation or a procurement. We should evaluate previously to the acceptance of a donation for a series of reasons. I mean, and Professor Clark has covered, I think, most of them. There was more a focus on biomedical equipment, but we can apply this for any kind of medical device, any kind of product in general. But today we talk about medical devices. But I can give an example of PPEs, those respirators, and kind of N95 or KN95 or FFP2. We had a series of cases in the world regarding falsified products, for example. So and substandard products that I would not give in many details today, but we had serious cases on when donations to countries in the world, from several donors, and then when we send this through a, for example, filtration test, there was below the minimum acceptable. Just give one example, but we can give you several other examples of sometimes biomedical equipment that what Professor Clark mentioned, that they donate the equipment and then there is no, I mean, it could even be like the minimum quality necessary, but there's no maintenance services, and then the capacity in the country, and there's a few countries in the region that have facing the problem that the equipment is waiting there and then becomes obsolete. No, but so definitely our recommendation is that regardless of procurement donation, follow the same process, guarantee the quality of the product.
Thank you very much for that, Alexander. Professor Clark, you have now a question regarding on the deployment phase. You were mentioning about the importance of acceptance and testing. Could you maybe share with us a little bit more about the main challenges that we see in this stage? Because indeed it's a critical component that sometimes that there is a little bit of oversight. So could you share in your experience some of the main challenges and maybe some tips regarding how to do appropriately this step of acceptance and testing?
Well, I can't emphasize enough the planning part of this process for deployment. You know, things such as, especially when you're talking about many factors that are involved before the technology would be used, such as building renovations or new building, or things like water systems that for cooling, things to reduce the humidity. All these utility items and infrastructure items, maybe IT items, that all has to be coordinated together. And many of the failures that happen are because of, say, construction delays, and the technology gets, you know, perhaps placed in storage for a period of time, and there may be damage to it. You know, there's one situation that just was recently discussed at another workshop, you know, where the storage for a period of time caused the equipment to not function correctly, and it was life support equipment. So I think just the integration of that planning process is most important.
Thank you very, very much for that, Professor Clark. I also take the opportunity to remind everyone that in the chat, we already put the link to the previous presentations, but also so that you can join our PAHO Caribbean community of practice on health technology management. For those of you who are new, please register and join us. We will continue sharing very relevant information regarding this. So I know that from the audience, Alana had a question and she raised her hand. Not sure if we can open her mic because she has not written the question yet. But in the meantime, again, regarding quality assurance, Alexander, maybe are there any sort of recommendations that could be given on incorporating like a regular process of quality assurance during procurement? And also what would be, or for those countries that do not have a regulatory agency for also supporting in these processes, what could be done, or with who should people can rely and get more information about quality assurance?
Okay, thank you very much for the question. Yeah, that's a very important aspect, no? Because we know that the level of regulatory capacity varies a lot across the region, you know? So, and we have been talking about regulatory reliance, which is a very important topic. But I think it's important that, first of all, we have a lot to do. We have lots of challenges in terms of strengthening regulatory capacity for medical device. We know that several countries have advanced a lot in medicines. We know even in the world, I mean, the medical device regulation it's first of all, it's much newer than the regulation medicines. And in the region, it's some of the countries have already established a solid regulatory framework for medical devices, but the majority not. Still a lot to do. But even if we consider the regulatory authority in the world that are, for example, members of the International Medical Device Regulators Forum, that's IMDRF, that is the most important forum of regulators for medical devices in the world. Even those regulatory authorities, in the context of emergency, they give emergency authorizations, for example. They give lots of emergency authorization for IVDs. They got lots of authorizations for PPEs, and in certain cases, even for ventilators. So we consider in our team at PAHO, we consider that we have to be very careful in those contexts using only regulatory reliance. So that's the reason we consider important the regulatory aspects essential, really important, but and combine with other aspects, with specifications, technical specifications, quality standards, that those are very important to be considered. And then going in areas like, for example, diagnostics, we know that most of the regulatory authorities do not require performance evaluations. So right now, we are working in incorporating some of the IVDs into the strategic funds. We are requesting performance evaluation because the regulatory reliance is not enough. So our message is regulatory reliance is very important. So we look for those because we know that the post-marketing surveillance is essential. So we have to make sure that this product that we are evaluating has regulatory approval in some of the countries that we consider has more solid regulatory framework. But in adding to that aspect, we have to make sure that it complies with a series of quality standards that we consider as essential.
Thank you very much, Alexander. And our time is basically over, but we have one last question that maybe Francisco can support us with right now. Is regarding the community of practice. A couple of people have been clicking on the link and started doing the registration, but they have questions of what website should they visit afterwards? Would they be receiving an email confirming that they are registered? What happens and how can they access the resources of the community of practice, Francisco?
Thank you very much, Begonia. Those are always important questions. So the form we have just put on the chat, everybody can register there. That's a form to show your interest. So we can have your email, your name, your last name, what institution are you from. After that, you will receive first an email from Professor Clark, welcome you to the community of practice, and then at some point an email directly from the platform. It's not as easy for us to send the emails from the platform. We have to do them one by one, so it's not that we can put them all together and send them all together. So it takes some time for us, but you will eventually, in the coming days, receive an invite from the platform. Once you receive that invite, it's not hard, but you need to do 2 steps. The first step is to sign up on the platform. The platform is called Price. We've explained it before, but the main point is that it hosts many communities of practice. And once you log into Price, then you can join our community of practice, the Health Technology Management Community of Practice for Caribbean countries. Those are the steps, but of course, I will just leave my email here in the chat if you have any questions and I can help you anyhow. Please don't hesitate on emailing me.
Thank you. That is very, very useful, Francisco. But in the meantime, be checking your email, your spam folder, just in case it went there, the email, and you can write to Francisco or contact your local PAHO office. And I'm sure that they'd be delighted to help you so that you can join us. And once again, thank you. I love participating in these webinars. I think they're extremely useful. Alexander, Professor Clark, again, thank you so much for all of this information. We're looking forward to our 5th webinar. We do not have a date yet, but be prepared, be on the lookout. We will be having a 5th webinar. And in the meantime, for those of you that are new, you can really review the previous webinars. They were extraordinary, just like this one. We have a more detailed explanation on the community of practicing. I think it was in webinar 1 and 2 that we went into more detail of the community of practice for those of you that may have questions. And if you keep on thinking about this and you do get another question regarding acquisition and donations, write to us. We'll be delighted to help you with it. And Alexander, over to you for some closing remarks.
Just thank you again, Begonia, Professor Clark, all our colleagues. I think in all the participation, the questions. I see lots of colleagues from the country offices here. Dr. Jack is here in participation. Thank you very much for your participation. So just thank you. We're very grateful. We are very happy with this series of webinars and workshops with the Caribbean countries. I think it's a great opportunity to share experiences and to learn from the countries and experiences. So this is we're going to continue, as Begonia mentioned. We have another webinar for sure this year, and other workshops that we've been having with these countries. And please join the community of practice. That's our opportunity to share experiences, case studies. Right now we are with Haiti, and we're in the course for health technology management. We're delighted with the level of participation. We certainly have a new edition of the course for English speaking countries next year. So lots of things going on, activities. So I invite you all to participate, engage in this community. Thank you very much again for your participation, and see you soon. Stay safe.
Bye. Thank you.
Everybody.
Bye.